Hey everyone, and welcome. Today we're going to break down the absolutely essential updates from the Medical Dosimetry Certification Board's Spring 2025 newsletter. And believe me, there are some really significant changes coming down the pike, so let's just dive right in.
Okay, so this is the big one. Right off the bat, the newsletter drops a major policy announcement that is literally going to reshape the certification pathway. This is the headline change, and it's going to affect how a lot of future candidates get certified.
So, to make sense of all this, here's how we're going to walk through it. We'll start with the big certification change itself, then get into why it's happening. After that, we'll explain the transition plan, cover some other key exam updates, and finish up with some important dates you'll want to circle on your calendar.
All right, let's tackle the most critical piece first. This move to a single, unified certification process. What this really means is that they're standardizing the entry point into the profession for everybody, and it won't matter where in the world you were trained.
And this line just lays it out perfectly. You see, before, you kind of had two main paths to sit for the CMD exam, but now, the MDCB is funneling everything into one single exclusive route, Route 1 Eligibility. So why is that a big deal? Well, if you're an internationally trained candidate, your whole pathway is about to change. And for students here in the US, it means the standard for your peers is now globally consistent.
Now I know what you're thinking. Why the big change? What was wrong with the old way? Well, the MDCB came to the conclusion that the international pathway was creating some inconsistencies, so in the newsletter they spelled out 3 really clear reasons for making this move. And the whole thing really boils down to creating a level playing field for everyone. It's all about procedural fairness, making sure every single candidate meets the exact same tough criteria. It's about maintaining those super high standards for knowledge and skill. And of course, it's about better quality control, ensuring everyone has gone through the same core curriculum and clinical experience. Okay, let's talk about the transition plan. Because if you're currently in the process or even just thinking about applying, the timing here is absolutely critical. The MDCB has laid out a very clear timeline with specific deadlines.
This timeline is basically your roadmap. So check it out. The very last exam under the old international rules is happening in September 2025. After that date, it's Route 1 only. But, and this is a really important but, there's an exception. If you're an international applicant who got accepted into a program in 2024, you have until January 2027 to get that first exam attempt under your belt.
But wait, it's not just about that big policy shift. The newsletter also had some other really important updates for anyone planning to take the exam. We're talking about rules on exam attempts and some new paperwork that's going to be required pretty soon.
First up, I want you to focus on the number 3. Yeah, just the number 3. It seems simple, right? But it's now a super critical number to remember, because it's at the very heart of the board's new rule on exam attempts. This rule puts a hard limit on how many shots you get at the exam.
Okay, this slide breaks down the whole rule, so let's walk through it. Here's the deal. You get 3 total attempts. That's it. And starting January 2026, a new 5-year clock starts ticking to use those 3 tries. Now, if you're unsuccessful on that 3rd try, a 2-year waiting period kicks in. After that wait, you can reapply, but you have to meet all the brand new eligibility rules at that time, plus earn 8 new CE credits. Oh, and here's a crucial little detail. If you're a no-show or you withdraw, that doesn't count as an attempt, which is definitely good to know. And speaking of what's new, here's another thing to put on your radar. Starting with the January 2026 exam, every single applicant is going to have to submit a clinical training certificate, and it has to come directly from their dosimetry program. So, you might be wondering, just how tough is this exam anyway? Well, for a little perspective, let's look at the results from this past January. We had 115 candidates take the exam, and the pass rate was a pretty solid 80.5%. That gives you a pretty good idea of the rigor we're talking about here. All right, let's wrap this up with the stuff you definitely need to mark on your calendars for the rest of this year and into the next. We're talking exam deadlines, MOC reminders, and some big association meetings. And here they are, all the upcoming application deadlines in one convenient spot. This covers the next 3 exams. Honestly, this is one of those slides you're going to want to pause and maybe take a screenshot of, just to make sure you don't miss any of these critical dates. And hey, for all you practicing CMDs out there, this one's for you. Just a friendly reminder about the maintenance of certification deadline. If your 5-year cycle wraps up on December 31st of this year, you've got to get those learning plans submitted by November 30th. Don't forget.
And if you're looking for a chance to network and get some continuing education credits, the AAMD has 2 huge opportunities coming up this year. You've got the 50th, that's right, 50th annual meeting in Las Vegas this June, and then the fall meeting in Fairfax, Virginia in September.
You know, when you step back and look at all these changes, the new eligibility route, the 3-attempt rule, all the deadlines, it all comes back to one thing, the MDCB's core mission. It's all about advancing the profession and making patient care better by holding everyone to the highest standards.
So, I'll leave you with this final thought to chew on. This move towards a single, unified, global standard for certification, it's a really big deal. And it leaves us with a pretty important question for the entire field. How is this one decision going to shape the future of medical dosimetry all around the world?